Okay, we're going to do some trach care on Mrs. Smith here. Before entering the patient's room, I'm going to go make sure I have all the supplies I need. I need a trach care kit, a sterile suctioning kit, canister for suctioning, also a resuscitation bag, a trach mask, any PPE that I may need for that might not be in the room, so like a face mask, and then also some syringes of sterile saline. So upon entering, knock knock, hi Mrs. Smith, my name's Kate. I'm from the respiratory care department here at the hospital. We're going to do some trach care on you today, okay? So the first thing I'm going to go ahead and do is suction out the trach. So your trach. So I want to make sure I have the suction set up here. I'm going to listen. I'm going to assess the patient first. I'm going to go ahead and listen to her vital or her breath sounds, check her oxygen levels. I'm going to check this cuff pressure, making sure it's in between 20 and 30 centimeters of H2O. And then we'll go ahead and do the sterile suctioning. So I'll open up the sterile kit. We can go ahead and oxygenate her. And upon opening the sterile kit, I open it up, you're going to see some gloves. It's a sterile procedure, so I'm going to insert, do my left hand first, and that'll be my clean hand, and then my right hand will be my sterile hand, and I'll go ahead and grab the catheter, suction catheter with my right hand, sterile hand. I can hook it up to the wall, and then I'm going to put some lube in my hand, in my sterile hand. So now that she's hyperoxygenated, I'm going to go ahead and make sure this is lubricated. All right, Mrs. Smith, we're going to go ahead and suction you out. I'm going to insert the catheter, and then once I feel a little resistance, we're going to go ahead and back up a little bit, occlude the thumb port, and suction out the trach. Okay, we can go ahead and get rid of that there. Now we're going to go ahead and do some cleaning. I'll give her some more oxygen after we're done with that. This is an aseptic technique, so we're going to go ahead and put that here. Let's go ahead and untie the trach collar. We'll take out the gauze here. I could take out the inner cannula as well, making sure I secure the flange on the trach itself. Here is this is a disposable inner cannula, so I could just toss this. If it wasn't in my trach care kit, there are some pipettes, and I can clean it with the sterile saline in one of the basins. So, and then I can set it, there's some gauze as well. I can lay that out, let it air dry in a safe area. The next thing I would go ahead and do is get my syringes and my Q-tips here, and I'm going to go ahead and hold the trach down, and from the inner side of the stoma and work my way out, disposing each time of each Q-tip after each swipe. Inner, out on both sides. While I'm doing that, I'm examining the stoma to make sure there's no discharge, foul smell, pinkness, redness, irritation, sign of infection at all. So now that it's all cleaned up, we'll make sure that we can get our new gauze that came in the care kit, gauze or foam pad. We'll go ahead and leave that on there. I'm going to tie a new trach collar on there, and then we'll go ahead and insert a new inner cannula. With our trach patients, we want to make sure that we have a spare inner cannula in there of different sizes as well, just in case there is some swelling or some change in the anatomy. So we'll go ahead and make sure that Mrs. Smith is in a comfortable position. We will check her SpO2, her vitals, her heart rate, and assess the patient that way. We definitely want to make sure that cuff pressure maintained in between 20 and 30. And then I'll go ahead and document and let the nurses know that trach care was done. Should be done at least twice a day.